The respiratory skeletal system provides structure for most of the body. From superior to inferior, we have the pectoral girdle consisting of the sternum, the clavicle, and the scapula. We have the ribs and the vertebral column, and inferiorly we have the pelvic girdle. The vertebrae and the vertebral column provide the primary support structure for the entire body. The skull rests on the top of the vertebral column. All of the ribs in the rib cage have a joint with the vertebrae, and the pectoral and pelvic girdles are connections to the vertebral column for the arms and the legs. The vertebral column also protects the nerves of the spinal cord and protects the organs in the abdomen and the thorax from behind. The vertebral column consists of 24 separate vertebrae. There are also fused vertebrae that make up the sacrum and the coccyx. The vertebrae articulate with the vertebrae that are above and below them, allowing some twisting and bending of the vertebral column. Each of the vertebrae in the vertebral column has a hole in the middle that the spinal column runs through, called the vertebral foramen. There's a spinous process that extends posteriorly from the vertebrae, which is palpable, meaning you can feel it from the outside of the body. There are also transverse processes that extend laterally and slightly posteriorly around the joints with the attachments of the ribs. The main body of the vertebrae is referred to as the corpus. It is anterior, and its primary function is to bear the weight of the body. At the top of the vertebral column, we have 7 cervical vertebrae, and they are generally labeled C1 through C7. C1 has a special name, which is the atlas. That is the vertebrae that the skull sits on, and it allows movement of the skull in terms of rotation left and right, to look left or right. C2 is also a special vertebrae known as the axis, and its joint with C1 allows the skull to pivot, like to lean to the left or to the right or to the front or to the back. So it lets you look up and down, for example. So putting the joints between the skull and C1 and C2 together, we have a great deal of freedom for movement of the head, allowing us to look in any direction. The thoracic vertebrae are the vertebrae that articulate with the ribs, and they are labeled T1 through T12. T1 articulates with the first rib, and T10 through T12 articulate with ribs 10, 11, and 12. For the other ribs, there is an attachment that's between the vertebrae of the same number and also the vertebrae above. So, for example, the 4th rib connects to T3 and T4, the 5th rib connects to T4 and T5, and so on. The remainder of the posterior abdominal wall is a combination of the lumbar vertebrae, labeled L1 through L5, the sacrum, which is a fused set of what used to be 5 vertebrae that articulates with the pelvic girdle, and the coccyx, which is a little bit of a residual tailbone that humans have. The pectoral girdle connects these bony structures to the upper extremities, our fancy anatomy term for the arms. We have the clavicle, which is superior to the rib cage and connects to the sternum at the front of the rib cage. We have the scapula, which is your shoulder blade, which is posterior and articulates with the clavicle. So the connections of the clavicle and the scapula to the remainder of the bony thorax is only through the one connection of the clavicle to the sternum in the front. The rest of the support for the clavicle and the scapula and the pectoral girdle in general is through muscles. That's a little hard to see in these images. Here's a picture of a model skeleton where there's an extra silver bar in there that's attached to the underside of the scapula. That's to put the scapula in the proper position even though there's only bones in this skeleton and there are no muscles in place to support it. So if you look carefully, you'll see the clavicle does not actually touch the ribs, and the scapula sort of floats out in the back, connected only to the clavicle, with the arm connected to that. So there's a fair bit of weight out there hinging on just that one connection of the clavicle to the sternum. So mostly that's your muscles in your upper back and neck that bear all that weight, which is probably why a lot of us have muscular tension there. The sternum is the bony front of the rib cage. It provides protection from the front of the body. The sternum is broken up into three pieces. The manubrium at the top is slightly wider. The corpus makes up most of the middle, and the manubrium and the corpus also provide attachment points for the ribs via cartilages. At the very bottom of the sternum is the ensiform process or the xiphoid process, which is just a little bony tab that hangs off of there that doesn't really connect to anything other than skin and muscles. There are 12 ribs on each side of the body. All of the ribs are attached to the vertebral column at the thoracic vertebrae. Ribs are divided up into different types on the basis of their attachment to the sternum. The upper 7 ribs, ribs 1 through 7, are called true ribs because each one has a cartilage attachment to the sternum. Ribs 8, 9, and 10 are called false ribs. They do attach to the sternum, but indirectly by attaching onto the cartilage for rib 7. And then the bottom 2 ribs, ribs 11 and 12, do not have a cartilage attachment to the sternum, so there are bones in the back and to the sides to some extent, but that connection doesn't continue around the front. The rib cage provides a lot of protection for the contents of the thoracic cavity, and then the connection between the ribs and the sternum by a cartilage also allows you to have some flexibility. The rib can be divided up into a few parts. Most of the rib is referred to as the shaft. It slants downward and anteriorly as it wraps around the thoracic cavity. There's a significant bend kind of where the rib transitions from being posterior in the back to wrap around the side. That's referred to as the angle. And then where the rib connects to the vertebral column at the corpus and at the transverse process of the vertebrae is referred to as the head. The ribs surround the thoracic cavity. The thoracic cavity contains a number of important structures. There's the heart. There's a variety of large blood vessels that connect to the heart. There's the esophagus, which is the tube that leads from your mouth and throat down to your stomach. And then there are the lungs, which are our primary interest for this respiratory section. The lungs are connected to the structures around it in the rib cage by 2 linings called pleural membranes. These membranes have some liquid in between them that creates an adhesion between the 2 membranes, allowing the lungs to expand and contract along with the movements of the rib cage. The pelvic girdle is at the bottom of the skeleton. It is a connection from the sacrum to a set of bones that provide the attachment points for the legs. The most important one for our purposes is the ilium, which is your hip bone. You can feel that around the upper sides above your legs on the body. The different halves of the ilium are connected at the front at the pubic symphysis, and we'll have a variety of abdominal muscles that are going to connect to these structures.